Cardiac arrest is a condition where a patient's heart stops, and during that period of time, there's not blood that's perfusing around their body and not blood to perfuse the brain with oxygen. During the cardiac arrest and the period of time that the heart is not pumping blood to the brain cells are running out of oxygen, and over a short time course, usually on the matter of a few minutes, brain cells start to die. And if patients recover from cardiac arrest shortly thereafter, they can survive without significant neurologic impairments. But for patients who have prolonged cardiac arrest, many of them have significant neurologic impairments related to the fact that some of the brain cells infarcted or died during that process of cardiac arrest. This study showed that the time delay to bystander CPR, so meaning, a community person who's next to somebody who has a cardiac arrest, that the time from when they have the cardiac arrest to when CPR is initiated is closely linked to outcomes of good survival, as well as survival with a good neurologic performance. And they found that the sooner CPR is started, the better. And when CPR is delayed by 10 minutes, that then the survival looks more like the people that don't have bystander CPR at all. So I think this abstract really nicely points out the importance of bystander CPR and the importance of early bystander CPR, and kind of a nice public health, nice public health data that supports the role of getting community members trained in CPR, because we know how important it is to increase survival after cardiac arrest. Survival after cardiac arrest and survival with a good neurologic state is incredibly important and very closely linked to patients that got adequate and early bystander CPR. So for me, when I'm in the cardiac intensive care unit, knowing that a patient got bystander CPR has very good, improves their prognosis significantly, and then also gives me a full armamentarium of support that I can offer them as far as heart support. Whereas for patients that don't get bystander CPR, that maybe are less likely to survive or have a good neurologic outcome, oftentimes our ability to support the heart is more limited in those patients. So the presence of bystander CPR, early CPR, and effective CPR not only improves prognosis, but also improves our ability to care for cardiogenic shock or life-threatening cardiac illnesses that they also often present with. I don't think anything in this trial was necessarily surprising, except, that eventually there's a time point at which bystander CPR doesn't improve outcomes anymore, which we kind of figured that would be the case. But what that threshold is, we didn't know for sure. So to see, that being described, even if bystander can initiate CPR within 10 minutes, there's still a benefit versus no CPR. I think that window is a long window, because for a lot of our patients, EMS can get to many of our patients. I mean, depending on where they are in Maine, if they're more rural, it may not be true, but certainly in more urban areas, EMS can often get there within 10 minutes. So any bystander CPR until EMS arrives certainly improves outcomes compared to no CPR. And I think from my standpoint, that's incredibly important to prevent the sudden death that we often see with cardiac arrest and try to improve survival, because the prognosis in this population is very poor, as was found in this trial and other trials. For all comers with cardiac arrest, a survival with good neurologic outcome tends to be close to 10%. So that means 90% of patients with cardiac arrest without bystander CPR either die or have very poor neurologic recovery. And so to know that with bystander CPR, we can improve that dramatically, I think for me is a real call to action, that we need to continue to do the work that AHA and other organizations are doing to train community members how to do CPR. And any CPR is better than no CPR. So you don't have to be an expert in CPR, but even if you know the basic principles, I think it can really improve outcomes for this population.